Hi, Dr. Patrick Gentempo here, and thank you for joining us on our YouTube channel. We have great content in store for you. I'm so excited to be here with you, and let's jump right into it.
And you're here, and earlier today you had a procedure.
Sure.
So tell us about that. What did you have done?
Yes, I done it yesterday. This morning, I'm sorry, this morning. It took me a little time to accept that. I agree with everything about stem cells, but I was a little scared of receiving infusion or transfusion of cells which was not mine.
Right.
I mean, I was always afraid by rejection, issues, which can be very serious.
Yeah.
Now, it took me a long time to be convinced by Dr. Vincent Giampapa that what we call umbilical cord, which are adult stem cells, but from a newborn, are not mature enough to initiate immunologic reaction when it's infused. So, of course, I didn't believe him like that. I need some scientific proof. That's what I did.
Yeah.
I go and search and find out that what he said was true. Also, the facts show me that it was true because there is some doctors in the world, including Dr. Giampapa, which are doing umbilical cord transfusion and which have a lot of experience. When I said a lot, is thousands of people without any adverse effect. So that was my first conclusion and my first reason to come here. The second one was the handicap. Until now I have handicap on the upper arms,
okay.
Here and the knee, here and the elbow and the twist. It was okay because still with that I can live. When I started to have handicap on the ankles, that's another problem because you cannot walk like everybody. Sure. You have handicap here, you cannot go up, go down, the stairs is a problem. This is why what Dr. Giampapa proposed me was very good, which was combination of umbilical cord infusion. Then they took the fat, take some very special stem cells from the fat, and with the fat.
So they took your fat?
Yes, they took my fat and re-injected at a very precise place in the two ankles. If you want, I can explain on detail what's going on.
Okay, so you're here in Costa Rica. Dr. Giampapa treated you this morning.
Yes.
Walk us through what you had done.
Well, first is assessment, and I have been with a specialist in ultrasound, which go to my two ankles with very special technical, up-to-date ultrasound system, which show me exactly where the damage was. The point for him was to find out where to shoot, okay, and what quantity of fat to shoot. Once he did that, I go to the surgery block, and then the first thing that they did is to take the fat. Now, this is what we call liposuction, but it's a special liposuction. It's not any kind, because if you want to go liposuction to take fat for weight loss, it's a kind of machine which is very violent because it's a suction, a real suction with something strong. Now you have to go manually, means you have to put a needle and you take it gently, the fat, in order not to destroy the content of the fat. That's what they did. They go slowly, and they know the quantity of fat that they have to take thanks to the specialist of ultrasound, which calculate how much fat you have to use in the two ankles.
So it sounds like they have all their technology down. They knew exactly what...
It's a very unique technology which gives you exactly, one, the number, the quantity of fat that you have to use. Second, where exactly to use it. Means I had 14 shots in the two ankles.
14 shots?
Yes. Okay. Because they want to treat this part and this part and this part. And this is guided by ultrasound all the time, which means that when they inject, they see physically, visually, where the fat is going.
So you know it's accurate?
Very accurate. Not only that, they are not using the fat as it is. You know, when you take fat, the fat contains different things, many very interesting things. Now, what they do, they put this fat in a type of filter, but very unique filter, which micronizes the fat, which means that the fat is going to be re-injected in the joint at 100 micron, which is 1,000 less than a normal molecule of fat. Not only that, this fat molecule will include not only stem cells, but very special cells which are around the vessels, which are extremely good. And also another thing called stroma vascular fraction, and other ingredient and growth factors too, which are extremely beneficial for the junction. Of course, these type of things can be done only directly to the joint, to other parts, but not in the blood, because the fat cannot go in the blood.
Right.
Okay, on the same time, I have an infusion of umbilical cord stem cells. And that's what I was afraid about, you know.
Yeah.
Why? How can I receive stem cells from somebody else in the blood without having a reaction? But I saw the fact, I saw many things, and I find out that those cells are non-mature or not enough mature to initiate immunologic reaction from my body. And that is a fact now, proven fact. No side effect based on thousands of umbilical cord infusion.
So what I'm hearing you say is while you were having this procedure, you got 14 shots. So those shots were the stem cell treatment direct to the areas that needed the treatment the most. But while they're going through that process, they also have you hooked up to an IV where you're getting a massive dose of these umbilical stem.
Well, several millions of stem cells.
Yeah.
So those stem cells, all these 5 million, will not be all active. Some will be lost, some will go in the lung. And in the lung, they will do their job. They will release some good active ingredient, and some of them will go everywhere. Why I need these blood stem cells, this umbilical cord? Because rheumatoid arthritis is a disease, a general disease. It's not only my ankles, it's my twist, my knees, my elbow, and my shoulder, everywhere, and even inside. So we cannot treat the problem only by direct injection, We can play and having the worst one treated, yes, but we cannot shoot everywhere. So we need to put it in the blood, because the blood is a highway. So if you put it in the blood, the different parts of your body which are inflamed will send a signal in the blood, say, please come, please come. And then each time in the blood, some stem cells will go to the part where it's needed repair and regeneration. Some others will go there, some other will go there. I'm not sure that we have enough to treat all the inflammation, but we think that when these cells, these very special adult stem cells will reach the target, they will reactivate what we call quiescent stem cells, means stem cells which are sleeping there, but they are there, but they don't work. So they are going to activate them, which they will start to work, to divide, and hoping that this injection will cure my disease. I don't think it will cure totally, because you have, on top of that, you have to go back to normal lifestyle. Nutrition, physical activity, stress management, relationship management, and so on.
I think it's absolutely fascinating that we can tangibly feel your energy. You just had this procedure done, the liposuction, 14 shots in your ankle, and this infusion, and you're sitting here, you've got high energy, you're glowing, you look amazing. How do you feel right now?
I feel fantastic. To tell you frankly, I don't want to tell them because they would be so happy. No, I feel really good. I didn't eat. Means I take only some fruits. and I stayed 3 hours in the table,
Okay.
which for me is very difficult. to
So the
tell you
procedure was
frankly.
3 hours for you?
3
essentially.
hours for me, but
Okay.
for me, 77 years with what you say, 77, we need to go pee-pee or whatever, you know. They can cut that if they want.
We should leave it in, really.
But we need to move also,
Yeah.
you know, a rheumatoid arthritis need to move his legs
Sure.
all the time.
Yeah.
So 3 hours without moving is quite embarrassing.
Yeah.
But after that, my God. Well, is it placebo effect when it's immediate
Yeah.
or not? I don't know. And I tell you frankly, I don't care
Right.
if it's placebo or not, but it
Exactly.
feels good.
Thanks so much for being here and watching that video. And can I ask you to please subscribe to our channel so you can find out when we're posting new content. You'll be alerted right away when we do. To share this with people you think might benefit from the information, and certainly it helps us if you like the video. So if you like what you just saw, go ahead and hit that like button. And again, thank you so much for being here with me right now.